Independent practices are being squeezed on all sides. Physician reimbursement has declined steadily in recent years, forcing many independent practices to vertically integrate into larger groups. In fact, 86.4% of physician pay has been flat or declined over the past 3 years. Fortunately, there is a solution. The Affordable Care Act has created opportunities for physicians to offer more services in-house, procedures called ancillary services. However, most healthcare professionals are largely unaware of their options, and researching and vetting opportunities is too time-consuming for already overworked physicians. Because of the increased demand for medical ancillaries, hundreds of medical ancillary vendors have entered the market. While programs that enhance point-of-care options and practice revenue are needed, the distribution model is inefficient. To complete an ancillary portfolio, practices spend precious hours vetting opportunities and dealing with countless sales reps. Not to mention, most ancillary sales reps carry one or a few programs, focusing on what's going to pay them the most commissions, ignoring the needs and goals of the practice. Because sales reps are often focused on promoting the highest paying ancillary, they seldom understand the full landscape of this sector. Our model is a completely new paradigm, a true practice consultant to be your single point of contact for all of your medical ancillaries. As a practice consultant, we understand not only how each program works, but the viability of each program and how it fits within the practice's current business model. We leave no stone unturned, finding every opportunity, big or small, so that you have a complete picture of the market. Our portfolio currently includes over 40 programs with over 60 vendors and growing. Each program in our portfolio is fully vetted to ensure that it meets our criteria. First, that it's patient-centric first and foremost, improving patient convenience, compliance, diagnosis, or treatment. It's turnkey, so it takes up the least amount of staff time, and meets the highest ethical and legal standards, while generating maximum revenue and improving a practice's value-based scores and/or creating cost savings and efficiencies that help your practice. Here's the process for how we work together. First, we'll meet with the key members of your staff to understand your practice and complete a questionnaire so that we can do a practice analysis. Next, we'll provide you with a comprehensive ancillary catalog, which gets updated each quarter so that you're aware of all of your options. Based upon your practice analysis, we'll make recommendations for programs that might best suit your clinic, fully explaining all costs, if any, and timeframes to implement. As a practice consultant, we'll work as your ancillary coordinator, helping integrate each service into your practice and being a liaison between you and the vendor. As we add new services for you, we will be in your practice daily, making sure all members of your staff are fully trained so that we can achieve the goals for your clinic. Our system is designed to work with all practice sizes and specialties. Here are some case studies. First is a primary care office with 3 providers, seeing 1,300 patients per month, 25% Medicare, 60% state Medicaid, and 15% a mix of PPO, cash, and workman's comp. This practice has implemented 7 ancillary programs, which has resulted in almost $200,000 a month in additional revenue, in addition to increasing patient encounters by more than 100 per month through the use of a virtual scribe. Next is a wellness med spa with 2 providers with 550 patient encounters per month, 100% cash pay. This clinic has implemented 5 ancillary programs, resulting in over $250,000 per month in revenue, in addition to increasing their patient encounters by more than 30 per month. Next is a single provider pain clinic with 360 patient encounters per month, 70% PPO and 30% Medicare. This clinic has implemented 4 programs, increasing their revenue by $48,000, plus adding 18 new patients per month through the physician referral program. A podiatry practice with 2 providers with 420 patient encounters per month, 50% Medicare, 25% PPO, and 25% workman's comp and cash, has implemented 5 ancillary programs, resulting in over $36,000 in additional revenue. We have created a simple and effective model. We will be your single point of contact for expanding your service offerings in the ancillary sector.